Okay, sir.
Right. Good afternoon to all. I'm Dr. Prasad Babu, Deputy Director, IGNOU Regional Center, Vijayawada. On behalf of Regional Center, we invite all the MA Psychology second year students regarding MPCE 15 and MPCE 25. MPCE 15 for the clinical psychology and MPCE 25 for counseling psychology. The internship program is common for all. Because of that, we have clubbed both the specializations, counseling psychology and clinical psychology. Today, we have called for the internship program, Dr. T.D. Vimla, Professor of Psychology, Acharya Nagarjuna University. Already, you know that Madam is very resourceful person, and Madam has been attached with the regional center Vijayawada for last 15 years. Madam is guiding all the MA Psychology students of IGNOU for last 15 years. In first year also, Madam has taken the practical sessions and some theory sessions also. During the Viva OC also, we have informed some other information. Now, regarding internship, what we have to do as per the handbook on internship, I think all the students of second year, you might be received the internship handbook by post. If anybody not received the handbook, please download the handbook from IGNOU of IGNOU website. And what you have to do in the internship. So there are 6 papers in the second year, each specialization, 3 theory papers, and 3 practical component areas. So MPCE 14 is a practical component, MPCE 15 is an internship, MPCE 16 project. So Vijayawada Regional Center is not offering a project. Because of that, we have suggested all the students to take the MPCE 46 positive, applied positive psychology. So I think all the candidates have taken the applied positive psychology. Somebody has taken the project MPCE 16 or 26. Those people are approaching the regional center Vijayawada. We are changing the course MPCE 16 to 46, MPCE 26 to 46. Even though if not known anybody how to change from project to positive psychology, please approach to regional center or just write a mail to regional center how to change the MPCE 16 or 26 to 46, or people will give you the guidance how to change the course change procedure and application and amount, what amount you have to pay and all those things. They will send you through email. So this is one aspect. And second one, you have to perform the internship 240 hours in a year. Means per day 8 hours, 30 days, or 6 hours into 45 days, or 4 hours into 2 months, like that. So totally 240 hours you have to perform internship any psychiatric nursing home, even clinical psychology or counseling psychology, and you have to take 10 case studies under the guidance of the clinical psychologist or psychologist or psychiatrist. So you have to take the guidance of the availability of the psychologist or clinical psychologist or psychiatrist. So take the 10 case studies, and already the format, how to write the internship case study. The format is available in the internship handbook. You go through the internship handbook and make it one case study pro forma separately, and take it out the 10 copies of the printouts, and you fill with your own handwriting of the case study, each case study, and clubbed all the 10 case studies and bind it and submit to the regional center. So while going through the internship program, what you have to perform, the duties or responsibilities during the internship while attending the psychiatric nursing home, all the details will be explained by the Professor T.D. Vimla Madam. So in between, what you have to do is, so for internship program, there are total 100 marks are there. So 40 marks for external evaluation. After submission of your 10 case studies, external viva will be there for that 40 marks. So remaining 60 marks. So 30 marks for the agency supervisor, where you are going for the psychiatry nursing home. So their doctor or clinical psychologist or psychologist will give you the 30 marks out of 30 based on your attendance, punctuality, sincerity, uh, whatever you have written on the case studies for 10 case studies. So reflection on the case studies. But how good you have written on the case study. So based on that, they give the 30 marks out of 30, whatever they want to give, they give the marks. This is one part. That is agency supervisor, psychiatrist or clinical psychologist or psychologist. Wherever you go, their agency supervisor will monitor your regular attendance, and they monitor your performance, they monitor your sincerity, they monitor your ethical values while attending the internship. All those things they see, and they will give you the marks. So agency supervisor. For that, there is a pro forma. The agency supervisor pro forma, page number 47. Already you have internship book. In that book, page number 47, appendix 5, there is a pro forma for 30 marks. Sincerity and professional competency, 10 marks. Assessment, case history, mental status examination, interview with the patients, psychological testing conducted by you with the client, and all those things they give the 15 marks. Out of 15, how much marks they will give, we don't know. And overall interaction with the patients, how you interact with the patients, how you deal with the patients, how patience you have with the clients, and all those things they will see and give the marks. For out of 5, they will give the some mark. So total 30 marks. This form should be filled by the agency supervisor where you are attending the internship program. After that, while you are attending for the internship program, your internship program will be monitored by one of the academic counselors of IGNOU. So one academic counselor will also monitor whether you are going to the internship program, whether you are doing the work properly, whether you are writing the report, case study report properly or not. All those things will monitor by the one academic counselor. So the academic counselor, we give the names of the academic counselor for counseling psychology and clinical psychology. For clinical psychology, Abdul Rafiq sir, he is a assistant professor in the VIT, Amravati campus, Vijayawada. So next week he will take the theory counseling sessions. During that time, I will give the SAR phone number. You can contact with him. And while doing the internship program, you have to contact with the Rafi sir. So you have to assess your performance, what work you have done so far, all those things. Once you complete one case study, you have to show to the sir. Then the SAR is approved, you can go ahead for the other 9 case studies. Every 3 case studies, you have to, academic council have to review your progress, and based on that, he will give you 30 marks. Out of 30, he will give some marks. So provisional diagnosis and planning of intervention, 5 marks. Your report, based on writing the case study, he will give the 20 marks. Out of 20, how much he will give. And overall understanding of the cases. So after interacting with you, finally while signing your 10 case studies, he will give the, out of 30, he will give some marks. This is the format. Appendix 6, page number 48. Academic counselor. For clinical psychology, Dr. Abdul Rafi sir, VIT, University AP Amravati, he will be the academic counselor for clinical psychology students. Regarding counseling psychology students, Dr. PV Radhika Madam, Assistant Professor SRR and CVR Government Degree College, she will be coordinating and monitoring of the counseling psychology students. So all the counseling psychology students will contact with the madam, and writing after one case study, you have to show your one case study to the Radhika madam. After approval of the madam, you can go ahead. Every 3 case studies, you have to show to the madam and review the case status of the issue, and then madam will guide you. So during the internship program, you have to touch with the agency supervisor and along with the academic counselor. Without academic counselor, if you do also, you get only out of 30, 27 or 25 marks. So academic counselor, if not given the marks, you will lose the total 30 marks. So because of all those things, you have to perform. And you have to perform the internship. So this is the information from my side. And regarding where you have to approach the for counseling or clinical psychology students for doing the internship, only we are allowing all the students to go to the psychiatry nursing homes where the case studies are more number of case studies available. If you go to the government hospital, okay, take the permission of the psychiatrist, you attend the 30 days or 40 days or totally 240 hours you have to spend there. Or if you go to the, any private clinic, or if any psychiatrist is doing private practice, you can approach them, and if they permit, you go there and do the internship. For that, if any necessary letter, formal letters are required, we will issue the formal letter. For that also there is a format, reference letter. I think format for reference letter, page number 44, there is a letter format is there. You fill it up that format and come to the regional center Vijayawada. I will sign on the reference letter and give it to you. You go to the concerned internship center and hand over and complete your internship program. So this is the procedure you have to do. So the last date for submission of your internship record is May 31st, 2025. Already university has given the last date. So 2025, May 31st is the last date to submit your internship record. So this is the information from my side. If any queries or doubts are there, I will clarify at the end of the this session. Madam also will give the inputs how to do internship and all those things. After that, I will clarify, and madam and myself will clarify your doubts. So last 15 or 20 minutes will take the questions. Madam, Vimala madam. Madam, freeze అయినట్టు. మేడం, విమలా మేడం గారు. Sir, in between, if any doubts and queries, madam is on the line. Okay.
Yes.
Yeah, madam, continue, madam.
Yes, is it audible now?
Yes, madam, audible and visible.
Okay. Good evening. Good evening to everybody. So till now you had the administrative aspect of all the internship and the assessment part, and everything is over. So what you have to do in an internship program, and what is the objective of the internship program? So this you have to understand before going for the internship. The main objective of this MA course internship program is to develop some practical skills and also some professional competencies to address, to
Madam,
extend your
madam, 1 minute. All the participants are, all the students are requested to type your name and enrollment number and specialization in the chat box. So we are taking the attendance. Please write your name, enrollment number, and your specialization. So we are taking the attendance. Based on that, I will take the records. Otherwise, I will not allow the records. So those who are not attending this program, we will not allow them. So because of that, we are taking the attendance. Please write your enrollment number, name, and your specialization in the chat box. Madam, continue, madam.
Yes, yes, sir. Yes, before going to the, what is the objective of this internship program? Whatever you have studied in your MPCE, you can extend your services to individuals or groups by learning the professional way, addressing the people in a professional way. So there is a lot of difference between addressing a psychological problem by a person with experience or in a ordinary way, and as a psychology student with a MA psychology, how you have to address the problems of individuals or in groups. For this is the main objective. The main objective is to develop the professional skills and competencies to address the individuals, as well as the groups. So in this program, as it is being said by Dr. Prasad Babu, that you are having 3 people are being in charge, they are monitoring your internship program. First is the academic counselor, agency supervisor, and finally it is on Viva. These are the 3 aspects of internship program. So here the academic counselor plays a major role. So it is being neglected. So you have to, even starting from selecting the agency, you have to take the approval, not written approval. If you are away from the Vijayawada and from different places, you can contact him at least by phone. And you just mention the dates when you have contacted your academic counselor and what is the discussion in a small nutshell way. So you have to contact your academic counselor for selecting the agency. This is the agency I am going to select, and if there is any clarification, they will give you. Then the suitability of the organization is also being given by academic counselor, and regular interaction while doing your activities will also be there, and for reporting and evaluation also academic counselor helps you. And then coming to the agent supervisor, you have to choose how to choose an agency. As it is being said, you can choose the clinical psychology, people can choose hospitals where the psychiatrist or clinical psychologist is available, wherever it is, even at rehabilitation centers where the clinical psychologist or the psychiatrist is available, you can choose one of the centers agency. The main criteria is the agency should provide you an opportunity to take case studies. That is important, to take case studies and to conduct some tests or something and counseling. They should provide you an opportunity at least for 3 to 4 cases. So that should be there. In the beginning, you have to observe what is going on there and you have to do. So you choose a center where there is an opportunity for you to practically to do the activity by yourself. So you can go for that. And for clinical psychology, counseling psychology, you can go to schools where there is a school psychologists are there in many of the schools, in Navodaya schools and some of the government schools at present, and the private schools also they are having, and some of the universities they are having counseling centers like that. So they are doing university counseling like Vijnan, there is an opportunity. Similarly, KL University, they are having a team of people are counseling. Hence, you can take those centers also, or old age homes where the psychiatrist or clinical psychologist is available, and you can go for rehabilitation centers. The main criteria is wherever agency you are going, there either a psychiatrist or a counselor, a professional psychologist should be available there, and you should get an opportunity to do 3 or 4 cases by yourself. not observing. You have to do it 3 or 4 cases at least by yourself. Minimum, I am asking you. So, 2 things you have to think about while selecting a agency center. They have to provide an opportunity to observe, because it should be what I can say that more it should be established 3 or 4 years back, and there a psychiatrist, a clinical psychologist or a psychologist is available. Professional psychologist is available. These 3 people are only they should be present in that agency. So maybe a old age home, maybe a child guidance center. There also we are having psychologists, old age homes, rehabilitation centers. Like that, whatever is available, if the criteria is there should be, and continuous counseling is being done there from last 3 to 4 years. So you can take those help, and you can take the cases, and you can do counseling there. So selection of agency is important. The main thing is they should provide you an opportunity to do the thing. Other important thing is you have ethical things are very important while doing this internship. You should follow the ethics of counseling. So already you have studied about the ethical consideration, developing confidence, not undermining the client or motivating the client. There are certain ethical aspects. You should not reveal the information with confidentiality should be maintained. It should not be discussed. It should not be revealed whatever happened in the counseling. So it is not for discussion. So this is this ethical consideration, and your behavior is also very important. So these are the behavior in the internship is very, very important. You are a professional. You should behave like a professional and interact with the people there, agency supervisor or other members present there. And that your behavior is important and your ethical considerations are important. Are you maintaining the time? Are you doing the activities in a committed way? All these are being observed by your agency supervisor. Since whether he observes it or not, you should develop the professional skills. Our goal is whether the agency supervisor is observing or not. That is not our criteria. Our criteria is to develop the professional skills and professional competencies from this internship program. This is our main objective. Main objective is you will develop confidence by studying the psychology if you have the appropriate skills and competencies. So this is the first important thing. For this, you have to, so after selecting the agency supervisor, after selecting the agency, you have to give the details of all the details of the agency and take the approval of your academic counselor. If he accepts that there is, so 2 criteria is important. He should give you an opportunity for you to do counseling and collect data, case study. That is one thing. And second thing is you should develop certain professional skills, because it should be an established. Now I will tell you what you have to learn during the process. You observe happening in that. So how you have to take cases? Then you have to start working with that. After first few days, you have how you have to take case studies, case histories. So all of you are having a pro forma with all in your that internship books, given a pro forma for counseling psychologists as well as MS mental health and as well as clinical psychologists. For both of them, the pro forma is being given. So the first step, how you have to take a case study and what are the things you have to do is by writing the case study. Before going into that, I suggest all of you be thorough with the psychological disorders and their basic characters. You studied so many mental disorders, psychological disorders, anxiety disorders, personality disorders, like that. Many disorders you have studied. Unless you have a sound theoretical knowledge, you cannot understand the case. Theoretical knowledge is also important. For that, because that your theory part is not yet over, I will ask all of you to prepare a chart on mental disorders. You prepare a chart. Usually we are going for minor neurotic disorders only. You have to think you will get the anxiety disorders, phobias, compulsions, some neurotic disorders only. You prepare a chart of all the common disorders and what are the characteristics, how you have to assess them. So this will definitely, this conceptual theoretical knowledge will help you to do the internship in a meaningful way. Theory is very important. Without theory, you cannot do the practical activity. Theory is also important, especially regarding the mental disorders and the basic characteristics of the mental disorders. So after the having this itself. So the first part, by doing this first part, case history and his present problem, you are knowing his present problem and his case history, you will have some understanding about the case, a little bit of understanding about the case. After that, you will conduct mental status examination. By conducting the mental status examination, you should be able to understand
So good afternoon. I think Madam network is not functioning in the university. Once the network is functioning, Madam will come in. And now, do you have any queries? Raise your query, and I will answer the queries. Hello. Yes, Madam has joined. Voice, mic on చేయండి మేడం.
And చేసా. Is it okay?
ఓకే మేడం.
Okay.
మీరు కెమెరా ఆఫ్
So,
చేయండి, అప్పుడు కొంత మీకు నెట్ ప్రాబ్లం ఉంది. కెమెరా ఆఫ్ చేయండి.
okay.
మాట్లాడండి. ఇప్పుడు
Okay. Right.
చెప్పండి.
So from this you have to, and second part you have to conduct the mental status examination. So in the mental status examination, what you have to do is you will understand the emotional status and the some other aspects of the problem which the individual is facing. So this is the second part of the uh, second part of the case history. First part you have to conduct the case history, and then so that you have some understanding about the problem, and you are going to the second part of that case history pro forma. You are conducting mental status examination, and by that you can understand his thought process, emotional status, and his speech, his interaction, the way of interaction. All this you can understand, and you will have some more picture about the client after the second part. The third part of the case history third part of this internship is case history is you have to, by understanding the individual by case, through case history and through MSc exam, MSc, you are able to conduct an interview to have more clarification about his status. So you have to conduct the interview. So you understand that this is the problem, this is the background, this is the emotional state. By this, till now, you understand all the things. So that you can understand the some aspects, what is the reason, you will have some more doubts. Then you have to conduct an interview. So this is most important thing. This is you have to conduct rapport building is the first thing while conducting interview. Till this he will give you all the information, your observation, his information, your observation, and also the after that you develop rapport with the client and start interviewing. You ask questions, you ask some of the questions to understand the client. Some of the questions to understand the client more clearly. To understand the client more clearly. So this is very important. This should be given in your case history in the as in a direct speech only. What you have asked, what is the response given by the client? All this should be given and presented in a direct speech. What did you ask and what is his response? Like that, to go into the more details of the client, you will ask some of the questions and it should be reported in a direct fashion. So by this you can understand three things. By his history, some information, through MSc some more information, and through interview some more information. You got all the information. Based on all the information, to make it more concrete, the fourth thing is you have to conduct a test. You have to conduct a formal test or simple informal test, some of the tests and psychological tests, and you have to write observation. For all these psychological tests may be needed or may not be, but you try to take some of the cases where the psychological test is needed and you are eligible to conduct the psychological test. So after conducting this, so you had information from case history, MSc, interview and psychological test. So that you are having all the information, you write down your observations, what you have observed, and then what are the your suggested intervention. You are not counselor is not supposed to give any treatment. You have what are the interventions you suggest to the person. What are the if possible, you can make it or you write down. If they don't allow, you can write down. Use of what are the interventions you are going to suggest. After that, you have to write your reflections on the case. So use some of the simple behavior. Are you clear? Yes?
Okay, madam.
Okay, okay. Yes, you said you are not clear. That's why. Okay. So, if, through intervention means an activity prepared. So, some are telling unable to hear. I think.
Madam,
I think
now
it's
we are able to
it,
hear in between some
okay,
disturbance,
okay,
but
okay,
now
okay.
it is okay. Now it is okay.
Okay, okay. So this is the thing. These are the things you have to develop the skills in these areas during the internship program. And I inform all of you, be clear with the theoretical aspect and try to have different cases because you are staying for 240 hours there and you are having only 10 cases you are taking. Hence, whenever there is a different case is there, you can take that case. Okay? And some anxiety cases, all neurotic cases, don't go for schizophrenia or depression, major depression. Don't go that major cases. Go for educational problems like that. Many problems you will observe in a clinical setting. Then don't think about, don't be worried about the drugs and all the things which are being suggested by psychiatrists. You think what intervention as a psychologist you can use to bring about modifications in his behavior. That is the thing. So for all the things you have to write all these things and what are your reflections. You just note down what you have to write. Be thorough with the theoretical aspect of that particular disorder. If you mention that this is a disorder, you should know what are the characteristics of that particular disorder. So that is important. Theoretical conceptual background is very important for your understanding. Then you have to write down the case history, mental status examination and interview in a direct fashion and a psychological test. Among the 4 or 5, you can take at least 1 or 2 psychological tests which are needed. And then you have to write down, you know how to administer a psychological test. So in the in the counseling setting, that you can understand by that. And then you write down your observations, whatever you have observed, make an analysis of the observations and make some conclusion. And then suggest, based on all this, you suggest an intervention program I told you what intervention is. An intervention program to bring about behavior modifications. So by this, you can earn this internship. So the main concept is for everything, all these 6 or 7 should be there for every case study. And one more important thing, while writing in your internship book, putting contents is very, very important. Don't bring internship books without contents. In that content, you have to write down the name of the case, and what is the, whether it is an anxiety case, a compulsion, obsessive compulsion disorder, what is the disorder? That case content should be there in the beginning. That is one important thing. Other important thing, for every case, you have to write all these things. And what I suggest is, when you are in contact with academic counselor, you should be in contact either by phone or depending upon the convenience of the counselor, academic counselor. You have to take a time appointment and you contact him. You can contact either by phone. You need not come personally always. This is waste of time for both the parties. Hence, whenever there is a need, you talk to them. If it is really nearby and they are willing, you can go there. Otherwise, without counselor and you have to contact your academic coordinator, and then after writing the first case study, with all this, you can put them, you can mail them or whatever is that is convenient. It is between you. One case study. After that, every 3 case studies, you just inform him, I have covered this. These are the case studies I covered. Then from 6 to 10, fourth meeting is from 6 to 10. After completion of the reporting is also very important. You have to contact him on reporting. How to report? While reporting, you also should have a contact with him. So these are the 5 steps. 5 times you have to contact the academic counselor, and just note down the dates whenever you contacted the counselor. And another important thing which is forgotten is, whenever you are in the agency, a diary should be maintained. Regular day-to-day diary should be maintained. That is also is important. That will be signed by the agency supervisor. The regular diary is being signed by the supervisor. So you can go to any agency where there is a psychiatrist, psychologist or clinical psychologist and having some experience in counseling. That agency should have an experience in counseling, means at least it was started 3 or 4 years back. At least 3 or 4 years back. So I think this is over. If you have any doubts, you can ask some of the doubts now. Yes?
Madam, one more thing I have to clarify regarding day-to-day activities and daily. There is a appendix 4, page number 46. One format is there. Format day-wise visiting. So what time to what time, which hospital, and all those things you have to write. And weekly ones are total overall after 1 month. They have to get signature from the agency supervisor. After that, academic counselor also sign on the record of visits. Outside signature of the learning. So if there is no space, if this is a single sheet, so I think 5 days or 6 days one sheet will come. Take a photocopies of number of copies. So total how many days you have attended. Day wise you have to write hours you have to spend there, and how many days you have attended. Total 250 hours you have to complete. So this is the information. Now any doubts or clarifications? గోపాల్ గారు వినపడుతుందా నేను మాట్లాడేది?
వినపడుతుంది.
ఓకే, I think they don't have any doubts. Nobody is responding.
Sir, good evening, sir. This is Rajesh. Sir, what time can I come with my reference letter to you, sir? Miss, when can I meet you, sir, for your signature on the reference letter?
All working days, Monday to Friday, 10 to 5.
10 to 5. Okay, thank you, sir.
Any other?
Yes.
Sir, can we do internship now and exams in December? No. So somebody is asking, exams in December means which batch? Now we are conducting internship for the July 2024 RR candidates. Benjamin has raised a hand. Who is Benjamin? మేడం మీరు మైక్ ఆపండి, నేను మళ్ళీ అవసరమైనప్పుడు పిలుస్తాను.
ఓకే.
Who is Benjamin? Nagadasi Benjamin. Any other candidate?
Hi, sir. Good evening.
Good evening.
So, can we do the internship in other than this street? I mean, like, actually, I'm from Kerala, so can I do my internship in Kerala and can I submit it here?
If you do your internship Kerala, who will sign here? Academic counselor.
So, can I submit the report to the counselor here?
Now, where are you staying now?
Now I am in the Andhra only, because I'm thinking about I take the clinical psychology. I specialize in clinical psychology. So like some language barrier is there, sir. So I'm thinking about that. I'm confusing about
Okay,
that. That's what I'm asking.
You take the permission from the agency supervisor in Kerala. You submit to me, then I'll give the permission.
Okay. Sir, one more request. Sir, what about the for the clinical psychology? Other than any online class, is there any offline class? If we get an offline class, means we are very grateful to you, sir.
You are asking about theory or practical? You are asking about theory or
theory,
practical?
sir. Both theory and practical. So I came to know that practically we already have classes in the practical, but theory.
No. Already theory counseling schedule sent to all the students.
But it's online only, sir. I think
online only are conducting theory. Practical sessions will be conducted offline for 5 days. That will be informed later.
Sir, I'm asking about the for clinical psychology. Is there any option to get an offline class, offline session for theory?
Offline session theory not available.
Not available.
Yeah, only less number of students are there. We are not conducting any offline.
Oh, okay. Okay, thank you.
Okay. Okay, thank you very much. Thank you, madam. for sparing valuable time and spend up to 5 o'clock in the university campus. Anyhow, small disturbances are there, but due to some technical and network issues, anyhow, we are thankful to Madam. Still, if you
Thank
have
you.
any doubts, please visit the regional center. We will clarify your doubts. Time is going up now. Sir, any idea of dates for our practical classes? Practical classes will be conducted in the month of March and or April. Due, based on the availability of the academic counselors, we will conduct. Okay, thank you. Gopal garu.
Thank you. Thank you, sir.
Ah,
Thank you, madam. Thank you, sir.
ah, ah. Thank you. Thank you.